I'm Dr. Michelle Reyes of the MedSpot, and we are having a huge amount of success with the GLP-1 agonists. And I'm finding that our experience in it is improving our outcomes. One of the fears that people have is that they're going to have to stay on it forever. And that was kind of something that I didn't know either. I didn't know what was going to happen once people reached their weight loss goal. And what has happened is that people reach their weight loss goal, they go off of it, and they can keep the weight off as long as they learned how to eat while they were on the Ozempic or whatever, semaglutide, tirzepatide. And I think that it's the education while they're on it that is the most important thing, as long as they understand that we need to use the drug as a training tool to help us learn how to eat. And if you're using it for that purpose, you can definitely learn new habits and get off of the medication. Once someone's reached their weight loss goal, I'll just spread the doses out. So rather than coming in every week, then they come in every 10 days, every 11 days. We keep spreading it out. We don't reduce the dose. We just spread it out. And the patients weigh themselves at home, which I find to be really important. It holds them accountable and helps them understand when they're starting to kind of lose a little bit of control. I really, really like our program because we have the patients come in every week, and there isn't an accountability factor. So sure, if you're going to have to see somebody, you're going to be a good girl about it. But it's also that it's holding us accountable to the medication success. So, if patients having problems with, say, constipation, we can help them with that. There's a million things. We don't want them to struggle with that. If they're having problems with it not working, maybe they're saying like, this just doesn't seem like it's working. I'm not losing weight. We can talk to them about what they're eating, or maybe we just don't have the dosing right. So that's why having them come in every week is really very, very helpful. It keeps us both accountable to the end success. What patients are telling me is that they literally can focus on what they're supposed to eat. So they don't wake up in the morning and they're like worried about the next meal. They know what their next meal is going to be, and they eat it, and then they're done. They don't think about it anymore, and they can move on to whatever else they're supposed to be doing that day. So a lot of people get a little bit obsessed and they get fixated, especially yo-yo dieters, because they'll lose the weight and then they'll gain it back, and then they feel guilty and shameful, and then they become obsessed with doing it, and so it becomes over and over again. So it's like there's a lot of noise up in their head it's negative noise. But with this medication, it kind of helps shut that off a little bit, so patients seem to be able to just do exactly what they're supposed to do. They eat what they're supposed to, and then they don't think about it anymore, and that's what they love. They also love the fact that they're able to have maybe one drink, and then that's it. They don't have the urge to keep drinking more or doing what, that's kind of an addictive type of activity. But they seem to have more control. They feel like they're in more control, and that's just really exciting for patients. They just feel like they don't have to worry about the food anymore. But they're learning. They're also learning that they're eating way too much. I mean, they just, like a lot of people think, well, I'm eating really well. Why am I not losing weight? And they might be eating well, but they're just eating a little bit too much for their activity level. And that's one thing that I think that has happened to us as a society, is we've really learned to be energetically efficient. So, we don't have to leave our homes for anything anymore. We don't even have to leave our seats to work anymore. We can just do everything online. So our energy expenditure is much lower. So that's why I think that contributes to our weight gain. So people are understanding that they're probably eating more than what they are they're spending. Yeah. During the pandemic, we actually learned how to do everything within our homes. We didn't even have to leave the house. We were really working hard on learning how to quarantine. And a lot of people's jobs changed for that reason. So a lot of people's activity levels dramatically dropped. And so that is a really big part of losing weight. And it's not about going to the gym. It can be just some sort of natural movement in your day, but walking is probably the best exercise you can do.